Hello students, welcome to the class. I am Yogitha. Our subject is Psychiatric Nursing and today we are going to learn about anger and aggression. Definitely, we can see a patient with anger and aggression in psychiatric ward. It's sometimes it's quite difficult for us to manage such patient. Now, aggressive behavior that may be intended like they are trying to harm others and they want to gain something by harming others. They don't have a patience to speak in polite way, in a nice way, and get that. Okay, so here this aggressive behavior, it may be a constructive, yeah, destructive. It may harm the self as well as it may harm others also. Now, what is anger? Anger is a uncomfortable feeling, emotional experience of an individual with irrespective to their own belief, value, and their status. They don't care anything and they express these uncomfortable feelings when they are not able to reach what they want, then or else when they don't get exactly what they want, or they're not able to express their feelings in a right way, then that may turn into anger. Now, aggression is a behavior which intended to cause harm or pain to others. Now, this aggression behavior may cause harm to myself or may cause harm to others. Now, it may be a physically a verbal like types. Physically, I may go and harm other, or verbally, yeah, with your words, use of your words, harsh language, you can hurt others. Now, let us see the types of this aggression: instrumental aggression and hostile aggression and rational aggression. Now, instrumental aggression here, individual want the object, a space, a privilege without intention to harm. They want the thing what they want, maybe a space, yeah, or privilege, the benefit that they want. For that reason, they will express their anger, but they don't have any intention to cause harm to anyone. But next, hostile aggression. Here, the aggression is intent in terms of harm. They may do a physical or verbal violence on others. They may try to harm others with their words, by kicking, hitting, threatening others. That can be done. And last, rational aggression. Here, they are intended like they do some impairment in a relationship, that's spreading rumor, talking negative about others. So it's not exactly involved in this physical violence, but they are trying to do something harm on others, like they're trying to spoil the relationship, a social relationship of that particular person, talking something gossips, rumors. These all things can be seen in rational aggression. So mainly we can see this aggression in three forms: instrumental, hostile, and rational aggression. Now, what's the cause? What's the reason to develop this aggression? Now, psychological theory says that maybe from the birth, okay, childhood, a child is neglected child, rejected child from the family. There is no proper parental love and care, affection, or no proper parental guidance. Such situation, chances are there the child may develop this a feeling of anger, a feeling of separation, yeah, negligence. Then a psychological factor that from the childhood, a child experience a severe kind of trauma, any assault, any harassment, that may change the emotional feeling of individual. Or from the childhood they have not got anything so easily, so they wanted to show their power, they wanted to prove their existence and grab the things. So that may be the reason. Then they developed it slowly, this anger feelings. Now, social cultural factors, when we see a society where they're living, maybe they're living in a slum area, criminal environment, the influence of other people, antisocial personality people, that influence, urbanization, industrialization, poverty, lack of knowledge, lack of education, or some cultural practice. It is a culture that they are speaking loudly, they're creating noise, harming others, they learn from the parents, or unsuccessful marriage, divorce, lack of satisfaction of some of your basic needs. These all factors again interferes with their development of anger. And some biological factors like any impairment to the brain or brain cells, so that particular hormone is not secreted, so that they're not able to have control over their anger, or they're not able to cope with the stress. Definitely when we see something which stressful to her, we will increase our physical complaints, like it may tend to increase our heartbeat, sweating, some butterfly in the stomach, but definitely that give a signal to our brain, so that produce some kind of steroids which help us to cope with such feelings. Now here some brain cells or a particular brain center got damaged, chances are there that the child, particular person, may develop not able to cope with the stress, develop this anger, yeah, aggression. So many factors, so many reasons are there to develop this anger and aggression. Now, what's the characteristic of a person with aggressive behavior? Definitely, with their physical appearance, we can make out that person is having extreme level of anger. Now, they verbalize their, they will express their anger in form of verbalization or physical activity. Verbal means they may use a very bad words, a strong words, which really tend to harm others or hurt others. Then physical, like they are hit others, like kicking and physical threatening to others. And sometimes they may have a direct eye to eye contact with the opposite person, so opposite person may feel scared to look at, they feel something discomfort when they continuously stare to them. And definitely they may always try to lean forward to the person to show their power, and they wanted to have a right over the opposite person, saying that he is more powerful. They may raise their voice and speak, the intensity of the voice will be too high that others will get scared. Sometimes their physical appearance, they'll like cross their feet, they'll stamp their feet, like they'll hit like themselves like this. Then all these physical gestures appearance will make the other person to sense that opposite person is really in anger mode and anything can happen. So these all are the way how they'll exhibit their anger. Now, how to manage the patient with anger? Definitely, to manage this anger immediately it's not possible. So, when they're having excessive level of anger and aggressiveness, we can tranquilize the patients. Definitely, we can use certain medications to sedate the patient. If the patient have any psychotic conditions, we can prescribe antipsychotic, antidepressant, anxiolytics medication to the patient. Now, when you come to the nursing part, it's very important that as a nurse, you need to manage the patient. We will do certain nursing interventions, like it's very risky to go to the patient when they're in excessive anger mode. So always you have a close observation of your patient. When you keep the patient in your room, the room should open outward. Patient should not latch himself inside from the room. Always avoid keeping some movable item in patient unit and nursing station, so that patient can take that and throw harm others. So always we should avoid such kind of items, and always provide soothing, a calm, a therapeutic environment to the patient, so that they are able to bring down their level of anger. Apart from that, we can use certain measures, certain tools to reduce their anger, like we can use some behavioral techniques like token economy. That means we can provide certain good rewards to the patient whenever behave rightly. So we will explain them a right and bad, good and bad behavior. When they behave that, we can give a reward to the patient, positive reinforcement, like something good offering can be given for the patient when they show the right behavior. Some kind of punishment when they exhibit a non-accepted, like aggressive behavior, so that has to be explained to the patient. Like a timeout, when the patient show an aggressive, bad behavior, we will keep the patient away from the reward what they receive. We'll train the patient when they are away from, taken out from this reward, definitely they may tend to behave in a right way. So we can use certain behavioral therapy, individual psychotherapy, a family therapy, provide some relaxation technique to the patient, teach the patient to develop good progressive muscle relaxation technique, and help them to learn this breathing technique, daily do yoga meditation. That will help the patient. So we can use all these measures which help the patient to bring down his feeling of anger, so that we can help the patient. So automatically they can have control over their feeling of anger, and that help the patient to have a normal life, having a simple, like reduced, stress-free life. So this is about stress and this is about anger and aggression. Please keep reading, keep watching. I'll see you in next class with a new concept. Take care of yourself. Thank you all.